Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors. We have a new sponsor this week, Altman Health System. Studio Arts and Glass, of course, from before, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guest is Janice Marciniak. She's only been with our company for like about 90 years. So anyway, Janice is a registered pharmacist and manager of our accredited compounding pharmacy. Good morning, Janice, and welcome to the show.
Thank you. It's great to be here.
The role of a pharmacist has broadened, and the Medicine Center Pharmacy has become a destination for patient care. Medicine Center Pharmacy continues to be an ideal place for healthcare advice, recommendations for over-the-counter treatments, and point-of-care testing. But did you know that we have an accredited lab that allows us to formulate custom medications designed specifically for you or your pet? This morning, we're going to talk with Janice and discuss pharmacy compounding at the Medicine Center Pharmacy, along with opportunities to develop a relationship with your pharmacist, a valuable member of your healthcare team. We'd like to remind our listeners today that our program is also available on our podcast. You can download it from the App Store on your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy and please subscribe.
So, Janice, welcome again to the show. As I said, tell our listeners a little bit about yourself and your background.
Well, I graduated from the University of Toledo way back in 1986 when pharmacy looked a little different than it does now. And like you said, I've been here not quite 90 years, but almost 16. So it's been a great ride. When I first got here, I really didn't know anything about compounding. Learned a lot just by being here. And then you folks sent me to a lot of training, and compounding has really become my passion now. Since then, I love being both a traditional pharmacist and a compounding pharmacist. I love how compounding lets me solve really unique problems. I'm also a certified HRT specialist, and that certification lets me delve more deeply into women's needs for hormonal therapy and all the compounding that's related to that. And when I'm not at the pharmacy, you could probably find me reading a good book or hiking or maybe camping or sailing.
Didn't I see a picture on Facebook on top of a mountain or something like that not too long ago?
You did. That was my first and only 14er, a 14,000 foot mountain in Colorado.
Whoa, no kidding. What mountain?
Handy's Peak.
Okay, because I've been there. Okay, several times. Okay, very good. So, Janice, compounding is a unique specialty. Tell us how it differs from traditional pharmacy.
Well, I like to use the analogy, it's kind of like buying a cake. With traditional prescriptions, you're going to the store, you're buying the cake that's already made. It might work for you, it's pretty close, but it just might not be exactly what you need. But compounding is like making the cake from scratch. We make the entire medication from beginning to end, and you get exactly what you need and what you want. And really, for most of the history of pharmacy, pharmacists compounded everything they dispensed. It was only in the 50s and 60s that mass manufacturing of medication came about. That was a good thing. It helped a lot more people have access to medicine. But over time, it turned into a one-size-fits-all approach. In the last 20 years, though, I'd say with new technology and techniques, pharmacists are getting back into compounding, and it lets us return to our roots and customize medication for a patient to meet their unique need. So we can work with the patient's prescriber to make a particular strength or a particular form of medication that's exactly what they need.
I'm not sure if this is later in the discussion, but I know that the new Philadelphia compounding operation is nationally certified. But what does that mean?
That means it's actually called the PCAB Seal of Accreditation, and PCAB stands for Pharmacy Compounding Accreditation Board. And we have to go through a pretty rigorous examination and application to get that. We have to fill out an application. We have to send a lot of documents called our standards of practice, which is kind of a fancy name for putting down on paper how we do everything. And Then they review all of that. They come, they do a very extensive on-site inspection of our pharmacy. And when we pass all of that, then we've gotten that accreditation. We earned our first one in 2007. We've been reaccredited every 3 years since then. So that is an extra step that we took as a pharmacy. We're also, just so patients know that what we're doing here is to the highest standards. We're overseen by the FDA and the State Board of Pharmacy. The State Board of Pharmacy.
So conventional prescription drugs are monitored by numerous federal agencies. How do we monitor our individual compounding preparations?
We are overseen by the FDA first. That would be the largest. They have a statement that compounded prescriptions are both ethical and legal as long as they are prescribed by a licensed practitioner for a specific patient. That's exactly what we do here. So we certainly meet that standard. We're also overseen by the State Board of Pharmacy in Ohio. And as you said, they oversee traditional pharmacies and they do inspect us that way, but they also oversee our compounding, and they will come and do periodic surprise inspections to make sure that we're complying with all the laws, meeting the standards we're supposed to. And then, as we were just discussing, we've gone the extra step to get that accreditation. So you can really be confident that we are practicing at the highest standards that are expected today.
So my understanding is that there's not a lot of PCAB certified compounders in the country. Is that correct?
I think that is correct. I don't know the exact numbers, but I know we were one of the first and that we continue to do so.
And you were the first in Ohio, as I recall. Is that not true? Or the first at the
We
time?
were the first medicine shop at the time.
At the time we were a medicine shop.
Yeah,
right.
First medicine shop in the country, technically.
And wow. And I know that took a tremendous amount of work and detail effort to put this thing together for PCAB certification. I think it's terrific.
All right, well, Janice, let's talk about how compounding can benefit a patient. I think sometimes terminology gets in the way, and compounding is a scary word. So maybe I like your cake analogy. So that was pretty neat, but let's talk about how it can benefit a patient.
It's actually, when there's no commercially made product, all the things on the shelf that drug companies make, a lot of times they don't quite meet a patient's need. And we can do a lot of different things. We can change the form of the medication. A good example that we do a lot of is something that only comes in maybe a tablet or a capsule. We make that into a liquid form. We do that for a lot of very young patients, infants and children who need heart medication, for example, and they can't swallow tablets. We can make that into a liquid. Cats are notorious for having thyroid problems. There is a cream that we make, and the owner is able to just rub that onto the cat's ear versus I try to imagine, shoving a pill down a cat's throat. It probably wouldn't go very well. So changing the form is a very common thing, along with if you need a special strength, if the strength isn't made, we can make it in the strength that you need. We can flavor medications to make them taste better, make them more palatable. We can combine medications into one form, and that might happen with hormone patients or pain medications, where there are 2 or 3 things in one preparation. So you only have to apply one thing each day. And in some cases, we can compound things that aren't available commercially anymore. And so if you have something that you used to take that worked fantastic for you and you can't get it anymore, I would encourage patients to call us and we'll check it out and see if it's something we can do for them.
So you mentioned a couple of different examples. Do you have any other examples of prescriptions that can be compounded you'd like to mention or touch on?
Yeah, we do pediatric formulations. Like I said, a lot of things for children. We do some pain management, which is mostly in the form of creams, and it's applied right to the spot, generally where the patient has pain. A lot of times that allows patients to use less oral pain medications, less opiates. Dermatology or skin concerns, of course, things like warts or rosacea, bioidentical hormone replacement therapy, and the veterinary needs, things for animals. Those are probably the most common things we do, but there are a lot of other unique things also.
I think it's time for our first break, is it not, Brad?
Yep.
You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call your Medicine Center Pharmacy to learn about a prescription delivery program.
All right. We were talking about some compounding solutions before the commercial break. So Janice, you mentioned bioidentical hormone replacement therapy. And earlier you mentioned you are a certified BHRT specialist. Can you tell us what that means and talk about bioidentical hormones?
I would love to. Back in 2018, I completed a program at PCCA, which is the Professional Compounding Centers of America, and called C4HRT, or Comprehensive Core Concepts in Compounding. Very intensive program. I had to do a very rigorous online educational program and attend an in-person symposium to earn that title. And I have to recertify every 2 years. So that's how I keep my skills sharp. And bioidentical hormone replacement therapy, or patients might see BHRT, that's the short for it, is a way to treat women that's very specific to their needs. A woman's hormones are very complex and they're very important to her overall health. They kind of work as a web, and everything has to be working together. You have to have optimal levels, the right levels of hormones, and they have to be in the right balance with each other. And in women, we look at the sex hormones: estrogen, progesterone, testosterone, and DHEA. And they also interact with some others like thyroid. And we kind of looked at all those together, as I said, to make sure they're in balance. When a woman is entering perimenopause or maybe menopause, they'll often have a lot of complaints, might be acne, low libido, they might have difficulty losing weight, fatigue or low energy, insomnia. A woman can have one of these, she can have all of these, she can have more, and it's very uncomfortable. And so when she's like that, if she comes to me or to her prescriber or physician, we can assess all of those symptoms. And then we also want to get blood work, so we get levels of her hormones. And we look at both of those things together. And then that will lead us to what we know we need to do for her individual plan of action. It's interesting that two women can present with exactly the same symptoms, but have completely different reasons for it. And so it's kind of solving that puzzle and then doing individually what that woman needs.
Can you tell our listeners what bioidentical hormone means?
It is a big name. It is pretty much exactly what it sounds like. It means that the hormones that we compound here that the patient will take home and use are identical in chemical structure to the ones that the woman's body makes. Another analogy, I kind of liken it to a key in a lock. A bioidentical hormone is the perfect key that fits right into that lock. Turn the key, open the door, the right message is sent, and everything that is supposed to happen does happen. A synthetic hormone is still a key. Sometimes you can't get it into the lock, or you get it in the lock and you can't turn it, and it just doesn't work quite right. The synthetic hormones that are commercially made, they're very similar to what a woman makes, but they're not exactly right. So they're not sending all the right messages. Hormones are the messengers in our body. They tell every system and every organ what to do, essentially. So if you're sending the right message, you make things better. And if you're sending a partial message or something that's not quite right, you can end up with a lot of side effects or adverse effects. And so that's what we see with synthetic. So that's why we think bioidentical is definitely the way to go. And as I said, can be completely customized to that patient.
Just as an aside real quick, I think one of the reasons that bioidentical hormones are so interesting, in my opinion, and maybe for listeners, it sounds obvious as to why you would want to put in your body what you already make. But a couple decades ago, the main hormone given to women was from horse urine, and it was not exactly what the human body made. And there were a lot of complications from it, and it is hardly used at all anymore, which I think is a very telling outcome for a product that is not of the human body. But I digress. So how about this? Is hormone replacement therapy only for women?
Absolutely not. Men tend to be much simpler, and I only mean that in the hormonal sense, nothing else. A lot of
Really? Okay.
Men these days, especially in the environment we have now, the toxins in our world, the stresses on our body, a lot of men suffer from low testosterone and or low DHEA. Those both decrease as a man ages. They can actually start decreasing in men in their 20s, and that just slowly keeps continuing over time. But we're finding that it's even speeded up. It's happening earlier because of the things I mentioned. Symptoms they normally feel might be a low sex drive, erectile dysfunction, loss of muscle strength. They feel weaker, a lot of fatigue and tiredness. And just like in women, we can pretty much do the same thing, assess their symptoms, see how they're feeling, take that in accord with their blood levels, and get them supplemented with testosterone or DHEA in the level that they need, so that it's both within the normal range and even in the optimal part for them. So.
Okay, now I know you have a special story from a favorite patient. What would you like to share with our listeners?
I think one of my favorite things, and I actually have 3 patients, and they are all allergic, severely allergic to the fillers that are used in commercial products.
Jeez.
The same filler is used in almost every commercially made product. And we have a gentleman that we are able to compound his blood pressure medication, for example, in a liquid form that he can take. You know, imagine if he didn't have access to his blood pressure medication and what that means down the line for his health. I think my absolute favorite is a patient. She has allergies to that, but she has allergies to many other things and needs to take allergy medication. Imagine being allergic to the allergy medications that you need just to survive and live in a halfway comfortable way. So we compound everything for her allergy medications and a couple of other things. And so that's been a real success story. All of my HRT women, they're all kind of my favorite as a group, just because that's my passion. So we've helped so many women, and we continue to help women. So that's a place I really love to work in.
What about expense? You know, patients might be wondering if compounding is too expensive for them. Is it covered by insurance, or where are we here?
That's a really good question, Paul, because I'm sure most patients probably think it's very expensive. But we find that it can be either. Sometimes a compound is less expensive, often actually, and sometimes more expensive. It does depend on the ingredients, the equipment that's needed to make it, how much time it takes. As far as insurance, we will always try to bill every patient's insurance to see if we can get it covered for them. I feel like it's probably around 40% of the time that it's covered, but we will always try that. And we have found on occasion, it's usually a mother who's going to bat for her child, that sometimes a compound isn't covered. But if you push the insurance company hard enough and you show them that in the long run, it's better and will save them money and make the patient more healthy, sometimes you can convince them to cover it.
Okay, you want to break now, Brad, or move on?
No, we got 2 minutes. Or a minute and a half. We can squeeze it in here.
Okay.
All right. So how do we make sure, how can a patient let their doctor know that their prescriber, and help their prescriber be aware of compounding as a solution for possibly their problem?
I would say two things. One, certainly the next time you go to the doctor, just ask him, say, do you know what compounding is? Do you ever prescribe compounds? And if not, say, I think you need to talk to my pharmacist. So, and if you think there's something that can help you, come in and talk to us. We will certainly work with your prescriber. We will make suggestions and answer any questions they have and kind of go to bat for you.
All
Okay.
right.
It is the bottom of the hour now. Time for your news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Thanks, Janice, very much.
Thanks, Janice.
Thank you so
Good
much.
information.
Thanks for having. Thank you.
Good morning. Good morning again. Hi, Paul White here. This morning, Brad and I are discussing the unique services available at Medicine Center Pharmacies. We have a lot more to cover this morning, so let's get back to the show.
Okay, this morning we'd like to introduce and welcome Austin Hopkins, Doctor of Pharmacy. Less waiting and more caring is the mission of our patient care program. And this morning, Austin will explain to us the program as well as discuss some of the important tips for your well-being during this beautiful summer weather.
So, Austin, good to see you. Take a moment and introduce
Good to see
yourself
you too.
to our listeners.
Well, for those who don't know me, again, my name is Austin. I am the staff pharmacist at the New Philadelphia Medicine Center Pharmacy. I have been a pharmacist for about 4 years now, and I graduated from Ohio Northern University, go Bears, about 4 years ago, so in 2018.
I beat you. I graduated a long time ago from Ohio Northern University. Okay. So you began your career as a pharmacist at one of the top 3 big pharmacy chains in the U.S.
Yes.
What made you switch to a local independent pharmacy?
So one of the things that I saw in the change and opportunity to go to a local independent pharmacy was the ability to expand my ability to practice as a pharmacist and the chance to learn what more I could do as a pharmacist. And in the time that I have been with Medicine Center, I have been able to expand my knowledge in compounding, learning the ins and outs of long-term care, and as well as seeing a lot more of the business and practical side of running a pharmacy and kind of seeing how those costs actually play in, which is not something I really got to see when I was part of the big chain.
Interesting. So Austin, what benefits do you feel a local independent pharmacy offers patients as compared to the large chains?
I think one of the biggest things that drives independence versus large chains is that their business model, especially Medicine Center's business model, is a lot more patient focused, a lot more driven through patient outcomes compared to other metrics. By that time, where we focus more on dedicating our time to the patients and their long-term well-being, I think it can reflect on better patient outcomes, better quality of life, and allowing us to more safely dispense their medications.
So
Excellent.
Go ahead, Brian.
No, it's fine. Excuse me. Austin, could you take just a few minutes and explain our patient care program to listeners that may not be familiar with it?
Absolutely, Brad. So there's kind of an initial focus in our patient care program on short-term benefits that lead to long-term positive outcomes for our patients. Those short-term benefits include where we line up medications to be picked up on the same day based on patient's desire. We can do that every 4 weeks, every month, or every 90 days. And as a courtesy and part of our patient program is that we would notify the patient in advance to what day their medications would be ready and available for pickup, usually a week and a half in advance. With this lining up of medications to be picked up on the same time, the long-term benefits that we see for our patients is that we promote better adherence, which is being able to take their medications on a consistent and daily basis, which will lead to a decrease in adverse events. So for example, someone who takes cholesterol medication may have a reduced chance of clogged arteries, which may lead to a heart attack or stroke. And so by taking their medications every day, we look to prevent those long-term complications down the road.
So our mission is less waiting and more caring. How does that benefit a patient and impact their level of care?
I I think this mission of less waiting and more caring aligns directly with our patient care program. Before a patient even shows up, kind of our approach when we give them that week and a half notice is that we are working behind the scenes to resolve any prescription issues that may arise before we refill the prescriptions. This may include issues with their insurance not covering a medication, or if we need to contact the doctor to get more refills for medication they're taking. And month to month, there are sometimes dose changes where they may have an increase or decrease in medication. So we can give them a partial supply of that new medication and keep them on track so that way they're not making multiple trips to the pharmacy. So by the time they have this pickup date ready to go with all their medications, those issues are resolved. In doing so, they have less waiting. It minimizes their wait time and decreases the chance that the patient goes without their medication. And again, this circles back to the idea of increasing the chance of preventing an adverse effect, and in terms leading to an increased quality of life for our patients.
Interesting.
So what other services enhance the patient care program?
What I think is really nice about the patient care program is that there are options to customize the patient care program to meet the needs of each patient. It is not a cookie cutter for every individual patient. For some patients who may have mobility issues who live within the local area, we do offer a free delivery option to deliver their medications on a monthly basis. Some people tend to have issues remembering when they took a medication, or if they're taking medications in the morning, afternoon, evening, and at bedtime. We have what's known as compliance packaging. So we will pre-package all their medications that they need for the day and at certain times. And that can be done either with packaging in-house or through an easy dose package that we work with our long-term care facility to prepare. And in my experience doing this patient care program, we've seen people get medications every 14 days to every 90 days. And again, there's that flexibility to work with the patient's schedule and allow them to pick up when it is most convenient for them. Additionally, we can also, if they get any compounded medication, those medications would be eligible to be part of our patient care program and get picked up on a monthly basis as well.
Okay, so Austin, you also manage our vaccination program in New Philadelphia.
Yes.
Are you seeing an increase in COVID cases and a corresponding increase in vaccinations for COVID?
Yes, for what I have noticed, kind of as of late, the BA sub-2 variant, which is this new Omicron strain that is out there, has a chance to evade immunity more often, which means it's more contagious and reinfection is possible. From what I've seen, there's been an increase in cases by roughly 17% in the last 2 weeks in Ohio. What's more concerning is that there's been an increase in hospitalizations by about 15% in the last week. Of those hospitalizations, there's been an increase in 18% in ICU capacity strictly due to COVID. And so those are trends that I tend to notice first. There hasn't been a massive influx yet of vaccination, but I am seeing more people coming in to try to get those booster shots that they may have been overdue for. And so that is something I cannot stress enough, is that if you are due for a booster shot, if you are eligible for one, the sooner you get it, the more likely you will be protected.
I heard this morning that there's numerous people that are getting COVID 3 and 4 times, which is amazing. So we're getting all these vaccines out there, but what sector of the population hasn't been inoculated here? Or
If we're looking at it on a national level, I believe the full vaccination rate of the country is roughly about 70%. So that's still 1 in 5 people in our country have not received a single vaccine. And so with these mutations that occur, those who have not been vaccinated or do not have a modified immune system from vaccines to the coronavirus have a higher likelihood of causing mutations and kind of perpetuating this ever-going pandemic.
Sure. So what other vaccinations can Medicine Center Pharmacy provide?
Aside from COVID vaccinations, the most common that I see are the shingles vaccine, which is available for anyone 50 and over. We also do provide pneumonia vaccinations as well as Tdap, which is our tetanus shot that also includes the whooping cough. We do provide vaccinations for hepatitis A and B, as well as vaccination for the human papillomavirus or HPV. And while we're not providing it right now, it's going to be right around the corner for flu season. I am expecting to be starting up flu shots again in late August and early September, right around the Labor Day holiday.
Gosh, already, yeah.
Well, I always get my flu shot on my birthday. It's September 8th. So it's always a nice little birthday treat.
Cool. I love it. Okay, so, all right, come in for a vaccination of any sort. How long does it take to receive a vaccine at Medicine Center Pharmacy? And what does the process look like on the patient side?
At this time, we're looking at about a 10 to 15 minute process. We take patients in on a walk-in basis at this time. You would approach the counter, talk to one of our employees or myself saying, I'm here to get a shingles vaccine. We'll check to see if you're in our system. And if you're not, we'll collect that information, put you in our system, get your insurance, bill the insurance. In the meantime, while we're doing all that billing, you would fill out a consent form, just making sure there's no indicators that would put you at risk for receiving this vaccine. And once we get that all squared away and we see that you're good to go to get the vaccine, you'll come into the vaccination room, probably talk with me, and I'll just make sure to address any questions, concerns about whatever vaccine that you are receiving. And once we're all good to go, you'll receive the vaccine. And if we need to schedule for a second dose, if it's more than one shot that's needed in the series, we'll discuss what day works best and kind of work out a schedule for you.
What about Corona vaccine they seem to be getting younger. Where are we on this?
As far as what we can do as pharmacists in the state of Ohio, from my understanding, pharmacists are only able to provide vaccination to those 7 and up. Based on the vaccine that we receive and its approval, we are capable of vaccinating, depending on what dose we're looking at. We are looking at vaccinating for 12 and up based on the inventory that we carry.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
All right, Austin, we get a lot of requests from patients when they come in the pharmacies, and we try to help triage and solve problems. I'm hearing that a common question is poison ivy, and what do we do? So do you have any recommendations for patients seeking relief from poison ivy symptoms?
Yes, Brad, I have plenty. A lot of products that we have available over the counter will address 2 of the main problems we encounter with poison ivy, which is most commonly the itchiness that people tend to have with poison ivy. The secondary concern is usually the redness or the weepiness that may occur. So a lot of products that you will see will have either a combination or will be a single product. The main 3 that I normally see are a mix of calamine lotion. We may also have Benadryl products and hydrocortisone. And calamine and Benadryl will work to help dry out any of the wounds or the rashes that may occur from poison ivy and help reduce that itching. Whereas hydrocortisone, sometimes with moisturizers like aloe, will help reduce the redness and itchiness that may occur with poison ivy. And if certain over-the-counters are not your preference and you may lean towards more alternative medicine, I do know we have a product called Ivygon, which is something that is a little more non-traditional, but it's available as a pill that will allow someone to hopefully reduce their episodes of itchiness and relieve their poison ivy symptoms.
I believe that's a sort of a homeopathic remedy. Is that not true?
That is correct.
And I believe they are very popular. And in many cases, I believe they're ineffective. I've tried them myself. So,
yeah, I will say that product in particular, we have had out of state orders that we have had to ship across the country because of the demand of that particular product.
Interesting.
All right, we all enjoyed being outside this time of year. However, we know in Ohio, more often than not, we're not getting enough sun exposure. Can you share some information about vitamin D supplements for patients and how it supports their health and wellness?
Certainly. So with what we have available at Medicine Center, there are two major brands that I would recommend that I know we have readily available. The first would be White's Premium, as well as Quality Choice. Now, there are a lot of vitamin D strengths available, and that's one of the most common questions that I get from patients is which dose is appropriate for me. And if we're looking at it for a wide range of patients, most adults would benefit from getting anywhere from 2,000 units to 5,000 units in the morning, typically with food or breakfast. And I say morning specifically because vitamin D does have a specific interaction with your body. It can interfere with melatonin release. So taking vitamin D later in the day may cause you to have a little restlessness later in the day. So I like to think when the sun comes up, so should be the time to take your vitamin D. That being said, some patients will look at labels and see that there's a vitamin D2 and a vitamin D3, and that's another very common question they get is which one is more preferable? Is there a difference? Which one should I take? And there's no wrong answer to getting vitamin D2 or vitamin D3. However, if you're looking to get the best benefit from the supplements that we provide, vitamin D3 is going to be a little more preferential because it's going to last a little bit longer in your body, and it's going to help increase your levels a little bit quicker and keep your levels in a good range longer. So by having those healthy increased vitamin D levels, patients tend to have better bone health and better immune health. Now, if you don't want to take vitamin D supplements right now, with it being summer and sunny, my general recommendation is no more than 10 to 30 minutes of midday exposure to the sun. And when I mean midday, those are between the hours of 10 a.m. and 3 p.m., about 3 times to 5 times a week.
All right. Well, no, anything in excess isn't good. So how about we talk about too much sun exposure and what you can do to protect yourself against sunburn and those unfortunate events?
Absolutely. So one thing that a lot of people may not be aware of is that when you're on certain medications, particularly antibiotics or certain medications to help your heart, those will increase your sensitivity to your sun and can cause you to burn quicker. And so I would always double check with myself or another pharmacist at Medicine Center to make sure, well, this, if you're getting a new medication, would this increase my sensitivity to the sun? That being said, before you even go out into the sun, it's important that if you're not going to the pool, but you're going out to do gardening or lawn mowing or any sort of outdoor activity, it's important to wear protective clothing. So long sleeves, thin material to provide some covering to a lot of the skin that may be exposed, wearing a sun hat, making sure you apply sunscreen, and most importantly, making sure you're well hydrated. With that sunscreen, you want to apply it about 20 to 30 minutes before going out. And the nice thing about sunscreen is you can't overdo it. So that's one of the stressors that I have with sunscreen is do not skimp on it. Do not try to put a thin layer, put it in on globules, try to like smear it all over, because it is something that can't be overdone. And you're not going to overshoot yourself by having extra sunscreen. And if you are going to be poolside or you are going to be sweating or doing a lot of physical activity, it is important to reapply it every 90 minutes. Now, if you didn't listen to any of that, you end up getting sunburned. Some of the recommendations that I would have, there's a particular product that I really like called Solar Cane. And Solar Cane comes in this nice, beautiful, clear green bottle. And it contains a mixture of what we are all familiar with if you get actually burned, called aloe. And it also contains a mild pain reliever called lidocaine. So this combination can kind of help moisturize and ease that burning hot feeling you may get from the sun. Again, another important step to take is, even though you may be sunburned, maintaining hydration is important because it will help allow you to recover from the sunburn sooner. And this is very common sense, but if you have sunburn, please stay out of the sun and cover your sunburns while you heal. Don't go back out. That being said, I do know we are having a promotion at our store that for any sunscreen that you do purchase, you do get a bottle of aloe gel free if you choose to do so.
What about aerosol spray sunblock as opposed to lotion sunblocks?
So there is a difference between two of those, neither of which would be a concern, but the way that they protect you are different. There is what's known as a chemical and physical barrier. So the chemical barrier that we're thinking about is that spray that you're talking about, Paul, where you may have an aerosolized bottle of sunscreen from Banana Boat.
Right.
And that works to basically prevent your skin from burning or getting overly exposed to the sun. Meanwhile, kind of the example I like to use is known as, it's called a physical barrier, where it is obscuring the sun's rays or UV rays to penetrate the skin. And this is known as, what we commonly see as zinc oxide is the common physical barrier we see. If you ever look at the movies and you see the lifeguard watching over the ocean with a little white
stuff,
mark on
yes.
his nose,
Yeah.
that's zinc oxide, and that's a physical barrier of sunscreen that can be
Sure.
used. And it depends on person to person as to which would be more preferred. I know some people may have sensitivity to certain chemicals that are made in that aerosolized sunscreen. And if that's the case where you may have a skin reaction to sunscreen that is chemically based, that zinc oxide tends to be a favorable alternative for people.
Wow, interesting.
All right, Austin, if our listener wants to get in touch with you or any of our pharmacists with questions, how can they get in touch?
Well, if you wish to reach out to me specifically at the New Philadelphia Medicine Center, you may call me at 330-339-4466. Or if you want to come in and see me personally, I am at 551 West High Avenue in New Philadelphia, Ohio.
Thanks, Austin. Sounds
Okay.
great.
Brad.
I think we're out of time. Very good.
We are.
Very good, Austin. Very good. Enjoyed
Thank
it.
you, Paul.
Thank you to our guests today, Janice Marciniak and Austin Hopkins. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, our new sponsor, Altman Health System, Studio Arts and Glass, and Genuine Appraisals and Liquidations, who has a tag sale this weekend on Saturday and Sunday in Akron. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.